We supply remarkably reliable infrastructures for healthcare. Some people will call it hospital grade. I call it the systems that I would want my child dependent upon if they're in the ICU suite.
If you've done any research around software development, certainly in healthcare, in the IT industry in general, you will have tripped over the word agile. It's extremely meaningful when put into a business context in which you can truly innovate. OST is the single vendor that we entered into that relationship with as really being on the forefront of what might that mean to rapid innovation in our environment.
We have fantastic application developers. We have extraordinarily gifted data center infrastructure specialists. But what we also do is we take design thinking and apply that to what we do for healthcare. We understand the problem space.
When you think about how tight the business and IT relationship has to be within a successful organization that's innovating on behalf of the consumer, your partner has to adopt that same presence and behavior. OST understands that. They have folks that are seated on our floors. We have folks that are down at their facility innovating arm in arm together.
Solid joint development activities that enable us to take the best and brightest people inside of OST and partner them in a team with the best and brightest people from our client and do something that is sustainable and is difficult but brings enormous value to the organization.
With the drive to consumerism of healthcare has come front and center the desire to have digital capabilities, web and mobile, and we clearly innovate in that regard, and OST assists us in that.
We're looking at the ways that technology is transforming healthcare. We also look at the way that technology is transforming the way we buy and purchase and how insurance is sold and how we engage with the healthcare delivery system.
But to some extent, digital capabilities and web and mobile applications are simply veneer if they don't have depth. The depth comes from the informatics and analytics that power it. We've been very, very close in partnership with OST as of late, understanding what are those informatics and analytics solutions that really truly power meaningful behavior change on the part of members, physicians, other constituents with whom we work, again, to drive better outcomes.
We have to be agile, responsive to the consumer, to the outward world. We have to be rock solid and have sophisticated, mature processes and infrastructure on the inside.
I think of examples in our market right now where we're innovating in agent-facing tools. We're doing that in partnership with OST. They're bringing not only project managers, business analysts, software developers, as well as the infrastructure component to bear to be able to deliver really best-in-class agent-facing applications for our insurance market so that we can be prepared to continue to achieve that type of market penetration in the individual market. That's a perfect example of how OST has become a strategic partner to us in the application space as our complexity and demands from our market has grown.